Hi, it's Dr. Stephen Smith, and this video is about erectile dysfunction that is not otherwise categorized. Most erectile dysfunction is really a vascular problem. It occurs more often, 3 times as frequently in diabetics with blood sugar issues who also have vascular issues. And it's very common as men get older. About 1 in 3 men at around age 60, 65 have some kind of erectile dysfunction, defined as inability to get an erection, inability to keep an erection through intercourse, or having an erection that's just not solid enough. The other problem that I see, and this can occur in men younger, also occurs in older men, and it's often accompanied with bladder dysfunction. Just coming out, I can't pee, I'm just stuck. Well, this is a neurological issue. It's the erectile function, is controlled by the Frankenhauser plexus. Now it sits in your pelvis, just in front of your spine, and your body has multiple plexuses like this. They're like the control centers in cars. You push a button, your window goes up and down, your headlights dim and automatically, etc. Those are all little computers that are controlling that operation. Well, erectile dysfunction is controlled by a ganglion called the Frankenhauser plexus. And it can get stuck, just like your PC can get stuck. And you have to reboot it. And how do you reboot the Frankenhauser plexus? Well, we do it with mesotherapy. There's also neurotherapy with a long needle down to the front of the spine, but mesotherapy is much simpler. We use a tiny needle about 1/4 inch long, 30 gauge, and we just inject along both sides of the spine and across the back, say from the kidneys on down to the upper part of the pelvis and at the base of the penis. These injections, if it's due to a blockage in the Frankenhauser plexus, will sting quite a bit because what we're doing is releasing electricity and breaking the block in the plexus. If they're not effective, then they don't hardly sting at all because after all, it's only a 30 gauge needle with 1/4 inch long. And what we inject is usually a homeopathic. Also, we may inject procaine, which is a local anesthetic, or a combination thereof. The therapy, when it works, is quite effective. Usually within a few hours, everything is working just fine. And the results can last for several months, especially if you've had it done more than once, then the treatment tends to last longer and longer. So if you're experiencing this symptom and Viagra is not working and there's no other reason for you to have this, then maybe the problem is part of your neurological system. And it's easy to fix. It just takes about 5 minutes to do these series of injections, and you'll be good for 4 or 5 months. You can read more information about it below in the comments section. Thank you very much.